welcome to Health Corner, your program where we discuss health. We look at issues that affect you and your health, or your loved one's health. I'm Dr. Henry Dungu, and tonight in the studio we are going to discuss how health practice is regulated. Tonight is the chance for you to understand who a right practitioner is and maybe who is not. In case of a problem, where can we do? But also to understand who are the people responsible for regulating the practice of medical and dental practitioners. I have the honor to have Dr. Katumba Sentongo Gubala, who is the Registrar, Uganda Medical and Dental Practitioners Council. Doctor, welcome to the program.
Good evening, viewers.
We also have Dr. Fred Nyankori, who is the Deputy Registrar, Uganda Medical and Dental Practitioners Council. Doctor, welcome to the program.
Thank you very much. Good evening, viewers.
I am glad
Happy
both
New
of you
Year.
have come. Yes, Happy New Year indeed. I am glad both of you are here because we've had quite a number of issues. People asking, who is who does what? But maybe before that, let me ask Dr. Katumba about medical council. How does it relate to the practitioner or to the people who are looking at us?
Thank you, Dr. Dungu. First of all, I want the public to know what this council is all about. Very briefly, this is a government agency which is in charge of protecting the interest of the public as far as health services are concerned in the country. The mandate this council has is derived from the Act that is Capital 72 of 1996, and the mandate is big, but we have always summarized it under 4 areas. The first one, this council is in charge of training and education of medical and dental practitioners in the country. 2, this council is also in charge of registering the doctors when they finish and their annual licenses. 3, this council is in charge of observing the standards of practice, how you work, where you work, what you work with. And then lastly, this council is in charge of disciplining the doctors if they don't do their practice very well. So that is the summary I can have for what the council does, on top of other things, which I might not go into details now.
And Dr. Nyankori, did you have anything to add to that?
Yeah, I wanted to add particularly about the regulation of practice.
Regulation of practice, yes?
Because at the end of the day, the public is very much interested in knowing what the practitioners out there are doing for them, and many questions that keep coming up is around the way that we carry out our practice. The medical practitioners are governed by a set of rules that guide the practice of medicine and dentistry. And the practice of medical ethics helps us to make decisions that will ensure that the practitioners' human rights, the practitioners observe the rights of the human beings. And these rights are really fundamental. They are universal, they are found everywhere, and they apply to everybody uniformly. The human rights of patients and patient care are embedded in the medical ethics. And Henry, I would like to go very fast and take you through some of the aspects of the medical ethics. One of them is the ethical obligation.
What is that?
These are things that by virtue of our belonging to the profession, we feel that we have got to carry out very well. And then there is the standard of professional practice. This one I would like to take a little bit of time and explain, and then the respect of professional etiquette.
Okay.
Yeah.
So maybe just remind you viewers who have just joined in, this is Health Corner on WBS, and we have the Registrar and Deputy Registrar of the Uganda Medical and Dental Practitioners Council. And they've told us about the basic roles. And somehow we'll go into the details of what they do. And Dr. Nyankore was just telling us about some of the obligations that doctors have to work on. Let's make this clear. I'll go back to Dr. Katumba. You are called Uganda Medical and Dental Practitioners. Does that mean that you only take care of doctors? Here I talk about both dentists and the other category of doctors.
Yes, correct. I have to say that we have 4 other councils in the country. The one we are in charge of is the one for medical and dental practitioners. But there's also one for the nurses and midwives. We also have that one for allied. Those are people in the lab, dispensers, radiographers, and then we have another one for pharmacists. So sometimes people think that the medical council is in charge of everybody. So we are only in charge of medical and dental practitioners, not traditional healers.
Not traditional healers.
Yes, not herbalists.
Even when they call themselves doctors?
Yes, we are going to answer that one in the future.
Okay.
Otherwise, they are using the title wrongly. It is for the doctors as we know them in Uganda.
I see. Dr. Nyankore, you are talking about the obligations of doctors and, I mean, medical and dental practitioners. Are you able to outline those a little bit further so our viewers can understand what do they expect of a doctor?
Yes, thank you very much, Henry. Like I said earlier on, that the obligations in ethics refers to what we expect.
What is that?
The doctor doing the practice to always uphold very jealously and adhere to at all times. I may break it into a few parts, like the respect of the human rights. Every human being has got a right to health care. Yeah, we would expect that once somebody falls sick and visits a doctor or visits a health facility, a person is going to get health care. And then there is respect to protection of privacy or confidentiality. Many you will agree with me that by the time you have made up your mind to go and see the doctor, you are going to be as transparent as possible. You are going to open up. You are going to share with the doctor many things about yourself. Some of them are very, very personal.
I know.
And you would expect them sometimes to remain personal to you, and possibly if anybody else is going to have information about it, is that doctor. So a professional doctor would keep it to himself, the information you have shared with him, unless it is in the interest of the processes of the treatment that you are going to get, that he would, in a manner of consultation with other professional colleagues, he can share it with other people. Then there is the issue of consent.
What do you mean by consent?
Many times, say in a healthcare facility, when a patient comes to a health unit, you think that by stepping into the compound of the health unit or by merely getting into the gate, then the patient has already consented to whatever you would like to do to him or her. That is not correct. We would expect you to explain to your patient, your client, what you are going to do to him, to her. You explain the benefits. You explain any adverse effects that may result from the undertaking that you are going to do. And then you get an informed consent. That one I mean accepting to undergo treatment or the management process the way you deem it fit, when he or she has got full information. Then the other one is, another right is, another obligation is that it's the right to die with dignity. It is your obligation as a doctor to make sure that when you are managing the patient, you know that the outcome is dichotomous. Of course, we would like to expect the patient to walk out in a better condition or recovered. But sometimes the unfortunate comes to pass. You may lose the patient. But we are saying that even in the tough times when you are treating a patient and you least expect any good outcomes, still make sure that your patient continues continues to get your services, and if the time of death comes, the patient dies with dignity.
Yeah.
Wow,
that's interesting. You know, many times we don't think seriously about the last statement, that even death should be respected. Dr. Katumba Sentong, okay, both names are right. You talked about training,
Yes.
being one of the roles of the council.
Yes.
What form of training do you give to health workers? Or is it before they get into the category of health workers?
Okay. Thank you very much. Now, training, the council works with the National Council for Education to accredit,
Okay.
to work together to ensure that the training institutions for doctors are the right ones.
Okay.
So our role there is that we receive curriculum from the National Council for Education, where these universities apply. We review and pass that curriculum. We work with the National Council for Education to inspect those universities before they start. And we continue inspecting them annually to see the progress. Education has been improved in this aspect with the East African community. East African community now wants all the medical schools to be accredited by the East African community. So the medical schools we have in all East African regions have been accredited. So we have additional support from East African colleagues to make sure that we have the same standards. And as a result, we have had our curriculum harmonized and the degrees harmonized. So if you do training in Uganda, you can work in Tanzania without any exams, Burundi, vice versa.
I see.
So East African community for us in the health department, I think we have gone a very big step in that. So that's the role we do as far as training. But I also have to say that internship is also part of training. Council does that through its committees, the national internship committees. But we are also harmonizing it as a community to have the same guidelines managing internship, so that when you do internship in any part of the country, you are not doubted in another country. So that's the role we are doing for education.
You know that thing of harmonizing training to make sure that you can practice in other areas?
Yes.
It is only for the region, right?
Yes. It's for the region because that's where we have the mandate.
I see.
And the people, for that matter, people who have trained outside East African region, we have started exams for them.
So when they are coming in,
when they come
they
to
sit
register
exams
with us as the second function, which I also mentioned, they have to do exams with us because we don't know their curriculum. We have not visited them. We don't inspect them. So people who have studied outside or people who have children outside, ask them to prepare for the exam because we are ready.
Okay.
Yes.
Dr. Nyankori, you know, Dr. Katumba has talked about registration of doctors. And I've noted it's one of the functions that you do. We have so many doctors. Do they all have to be registered in order to practice?
I would say yes. If the doctor has undergone training and has qualified as a doctor and has gone through the other requirements subsequent to the training, we expect them to undergo internship, which is also a form of training under supervision of the senior colleagues. We would expect the doctor, if he's interested in practicing in Uganda, to get registered as a role.
Okay. So but in order for someone to practice, they should register?
Oh, yes.
If I intend not to practice, I don't have to register?
If you don't want to practice, you may not register.
You may not.
But this should be understood very well.
Okay.
Where practice may not necessarily mean interaction with the patients or getting onto the ward to manage patients. Sometimes we get these keep coming up as a matter of concern, and we have got to take time to explain to them. For example, some of our colleagues who have gotten with NGO world, they may not be directly practicing. They may not be treating patients, but they may be handling records, they may be handling documents, which either input into the management of the patients, or they use the information obtained from the patients in order for them to get such records. So but they may not be directly working, but they are, we consider them as practicing, so they have got to register. Take an example of the colleagues working in, say, like the Ministry of Health. They engage in policy making.
So do they have
They
to
don't
register?
see patients, they have got to register.
Now, this takes me to the other question, and none of you can respond to this.
Yeah.
The difference between the third role, the annual practicing license, and registration, are they the same thing? Maybe Dr. Katumba can go into that.
Okay, they are not the same, but related. One, everybody who has qualified ideally should register. Should register when you have qualifications for the first degree, you have to register. And then to work in the country, you have to get an annual license. This is not a Ugandan phenomenon, it's an international phenomenon. You must have a license every year. And my colleague here was explaining the categories of people who should actually have the licenses. So you have to do that. I have quickly to say that the registers we have in the country, we have the full register, that's the permanent. You have to register there whether you want to practice in the future or not.
I see.
Okay. Then annually, you have to get a license to practice. It's very illegal to work in any country if you don't have a license.
Doctor, sorry to interrupt you here. This is an extremely important topic about registration and practicing licenses. Let me go for a short break. When we come back, we are going to continue with our discussion about registration and who should practice, who should treat you. Should anyone just treat you, or should there be evidence that this person is registered? When we get back.